Welcome to the Art of Delegation. My name is Melody Routley, and I'm a Nursing Professional Development Specialist for the Kaiser Permanente Northwest Regional Hospitals, as well as a CNA2 educator. And today we're going to talk about delegation. We're going to learn and identify the 5 rights of delegation. We're also going to compare and contrast what responsibility, authority, and accountability mean in the delegation process. We know that there is way more nursing to do than there are nurses to do it. As a matter of fact, the American Nurses Association, as well as the National Council of State Boards of Nursing, share the same message. Delegation is essential. We have to effectively delegate in order to provide safe patient care. Why then are so many nurses reluctant to delegate? Why do you suppose that is? Well, before we go down that path, let's take a closer look at what delegation is. Delegation is the process a nurse takes to direct another person to perform a task or duty. It's that transferring of responsibility and authority to perform that task while still retaining the accountability for the results or the outcome. There's 3 words that are shown in that particular screen. We have responsibility, authority, and accountability. Accountability is reviewing judgments and decisions and then evaluating the effectiveness of those judgments and decisions and still directing future efforts. Authority is the right to act in areas one is given and then accept the responsibility of those actions. And responsibility is a two-way process that must be given and received. So in a delegation, the nurse gives or allocates or assigns a task, and then the CNA2 must accept that task. Does that seem simple? Delegation is actually really difficult. Here are some of the excuses that you may have heard on the nursing units regarding why delegation is so hard. Usually it centers around, it takes too much time, I don't trust the level of competence of my team, I'm responsible for my patients, I'm worried about making mistakes, and it's too hard to articulate what it is I want the CNA to do. But delegation is important. Delegating utilizes resources more effectively, and with that increased responsibility, it builds leadership and team. It also allows tasks to be completed more effectively and with greater efficiency. So let's take a look at these tasks. Let's take a look at the 5 rights of delegation. The first right is the right task. You can't just delegate any tasks. The tasks have to fall within the RN scope of practice, but is not the RN process, the nursing process. Delegated tasks should require little supervision and have minimal potential risks for the patient. The right task is based off of the CNA2's approved list of duties, and that is a list comprised from the Oregon State Board of Nursing as well as our Kaiser Permanente Northwest region. The right task is followed up by the right person. The right person, you have to ask yourself, am I the right person delegating the right task to the right person to be performed on the right patient? So keep in mind job description, competency checklist, and demonstrated skills. Have you seen them actually do this particular skill? The third right is the right situation. You only want to delegate in a situation where the patient is stable and all outcomes are predictable. So you have to consider, is this the right patient setting for delegation, and do I have the right resources available? A big right in the 5 rights of delegation is right communication. Both the nurse and the CNA have to be very clear, concise, correct, and complete in that delegation process. Included also should be, what would you want the CNA2 to report back to the nurse? This communication must be ongoing throughout the whole shift. And in that communication process, you need to figure out what level of authority you're granting in that delegated task. There are 4 levels of authority. Level 1 is data gathering. So you're going in, you're gathering information, and you're reporting it back to the nurse. Level 2 is you're going in, gathering information, formulating a recommendation, and giving that recommendation to the nurse. Level 3 is you're going in, you're gathering information, you're formulating a recommendation, you swing through, let the nurse know what you're going to do, double check, and then act on your information. And then level 4 is you go in, you do your tasks, and then you just let the nurse know anything that came from those tasks. So an example of a level 1 data gathering, level of authority, would be the nurse asking the CNA, could you go in to check on room 103A and see if the pain is better controlled? and then let me know what their pain score is. So that's a level 1 data gathering. Level 3 data gathering would be, could you go in and check on our patient in 103A and see how she's doing with her pain? So the CNA would go in, see what level of pain the patient's in, and then decide, I think the patient would be better and more comfortable on their other side. So she swings by with the nurse and says, hey, the patient's reporting pain for 7 out of 10. We're trying to get it down to a 4 out of 6. Can I turn her to her other side and give her an ice pack? That would be a level 3 level of authority. And then level 4 authority would be going in, checking on the patient, and then making her more comfortable by either putting on an ice pack or switching her position, and then just letting the nurse know what you did. So those are the different levels of authority. So it's important for any delegated task that you understand what your level of authority is before you go in and do that task. Communication is a two-way process, and as a CNA, you need to be responsible for your part in the communication. So please ask questions and seek clarification on anything that you don't understand or have questions for. Making sure that you are informing the nurse of all the tasks that you've done or not done, or any of the patient's responses to any of those tasks. If you don't know how to do a task or don't know how to do a task well, make sure you ask for additional training or to ask to be supervised so that you can gain the necessary skill to perform that task. And then determine how the nurse wants to be communicated with in an emergency situation. Documentation is also part of communication. It's extremely important for the CNA to document ongoing as they provide tasks or as they gather information about the patient. It's better to enter your information in at the time that you gather that information, because what that does is it keeps the health record, the patient's chart, in the most current updated state. The final right is right supervision, and included in that is right evaluation and feedback. The nurse has to follow up with an assessment of the patient because she's still accountable for the outcomes. The nurse should evaluate the CNA's performance and then give feedback to that CNA. We all have to make it very safe for our CNAs to ask any kind of clarifying questions and to ask for support and help. There are some situations where we don't want to delegate. These are situations where we have a very complex patient situation that requires high-level assessments, critical thinking, and clinical judgments. We don't want to delegate when we don't know what the outcome is going to be for that task. We don't want to delegate if there is a potential for harm or increased risk of harm for that particular patient. Those are the 5 rights of delegation. So what I would like to do is you have a delegation exercise. It's a handout, and on the left-hand side there are 12 tasks or duties. And what we'd like for you to do is to think about those tasks and decide who should do it, the nurse or the CNA. And then why did you select the nurse or why did you select the CNA to do that task? So let's do the first one together. It says here, formulate the patient's plan of care. Who do you think should do that, the nurse or the CNA too? I know that the patient's formulating a patient's plan is part of the nursing process. So therefore, I know that the nursing process can't be delegated, so I'm going to have this RN do that. So the nurse is going to have to formulate the patient's plan of care. Let's do one more. Number 2, provides oral care to a patient on aspiration risk. What do you think? A patient on aspiration risk, is that a high-risk patient or a complex patient that maybe we shouldn't delegate on? You know what? I think that I'm going to assign this task to a CNA2. I know that our CNA2s have the necessary skills and competency to do oral care on a patient who is on aspiration risk. So I'm going to assign that task to a CNA2. So go ahead and finish completing the delegation exercise, and then at the very bottom of that page it asks, what was the most difficult task to determine? So of those 12 tasks, which was difficult for you to figure out, should the nurse do it or should the CNA do it? And then ask yourself why. So go ahead and pause this video and complete that exercise.